If you're living with dry AMD, age-related macular degeneration, you already know that something is not right. Faces look distorted. Reading takes more effort, and the center of your vision isn't what it used to be. I want you to know that you're not alone. There are steps that you can take to help protect the vision that you still have. In just a few minutes, I'm going to show you research-tested acupressure points that are known to support macular health and clarity. First, let's take a look at what's actually going on inside your eye and why these points are so important. Here's a healthy eye over here, and we can see in the front is a clear coating called the cornea. Right behind the cornea is the colored part of your eye. That's the iris. There's a little hole in that called the pupil, and the iris can expand and contract so it can let in more or less light. Behind the iris is the lens, and the lens focuses what you see on the back of your eye over here. Now, over here is the optic nerve, where nerves and blood vessels come in to the eye. Here is the retina. This is the light-sensitive, color-sensitive tissue in your eye that actually records images. And over here is the macula, which is the most important center part of your retina. And it has to deal with sharpness of vision and central vision. And right over here is the fovea, which is the central part of your vision. In a healthy eye, we might be looking at an apple over here. That image gets transmitted through the eye, and up here, the brain sees an apple. And it's a pretty good representation. Now, here's what happens with macular degeneration. The macula begins to swell. There is less blood flow to the eye, and waste builds up inside the eye. This combines to provide a less strong vision signal, and the apple that your brain registers looks a lot more like this than right over here. Now here's the encouraging part. With specific time-tested acupressure techniques, you can help improve circulation in the retina and reduce inflammation naturally, even if you've already started to have macular degeneration. Studies show that after acupuncture point stimulation, macular swelling is reduced, blood flow is increased, and some of the waste begins to clear. And it might look like this right over here. We see the macula is less swollen than previously. The blood flow is increased, and some of the waste products are now cleared away. So when you're looking at an apple like this, your brain is going to register an improved image of an apple like this instead of one like this over here. I'll show you exactly how to find these remarkable points in a few moments. Supporting your eyes starts with practical everyday choices. Eat a nutrient-rich diet filled with dark leafy greens, berries, wild-caught fish, and specific eye antioxidants like lutein and zeaxanthin. If you're not getting enough from the foods that you eat, a high-quality supplement can be beneficial. I've included a link below to the one that I recommend for my patients. Next, staying active supports healthy blood flow to all parts of your body, including your eyes. Wearing sunglasses to protect your eyes from UV rays is important. And try to find an eye health professional who focuses on prevention, not just prescriptions. Now, I'll walk you through the acupressure points used in traditional medicine, supported by modern research for macular and retinal support. These points are arranged for best results, so I recommend following them in the order which I show you. My name is Dr. Barrett. I'm a chiropractor, nutritionist, herbalist, and I'm an expert in Western acupuncture. I've dedicated my life to helping people just like you avoid unnecessary medications and surgeries by offering them options that are both safe and effective. If you find this video helpful, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos like this come out. The first point recommended for macular degeneration is located at the inner end of your eyebrow in a small dip just above the inner corner of your eye. So to find this point, just go along your eyebrow. When you come to the end, you'll find like a little dip there. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 20 to 30 seconds, like this. Now find and activate this point near your other eyebrow. When we're working near the eye, I recommend that you wash your hands and trim your nails before pressing on any of those points, and I don't recommend using instruments. This point is traditionally used to relieve eye strain and improve circulation. For people with dry AMD, stimulating this point may help support blood flow to the macula and relieve tension in the area around the eyes. The next point recommended for macular degeneration is located on the top of your foot. To find it, start with the space between your first and your second toe, right over here. Then move up towards your ankle. You'll be between two bones. Keep moving up until those bones seem to come together, right here. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 20 to 30 seconds, like this. Or if you have a Tei Shin, you can pulse it 25 times, like this. Now find and activate this point on your other foot. In traditional East Asian medicine, this point is said to open the eyes. This point is believed to help move liver energy and nourish liver blood, both of which are critical for maintaining healthy vision and supporting macular circulation. The third therapeutic point is located on the inside of your lower leg. To find this point, find the tip of your ankle bone right here. Now find the point that's the width of 4 fingers, like this, above it, right here. Push in to find a point that is sensitive, sore, tender, or painful. That is the point. Massage this point in a circular motion for 20 to 30 seconds, like this. Or if you have a Tei Shin, you can pulse it 25 times, like this. Now find and activate this point on your other leg. This point is especially important for improving blood quality, fluid balance, and overall vitality, which are all important for managing dry AMD. For those who want to prevent dry AMD, I recommend that you find and activate these points 3 times a day for 30 days and then use as needed thereafter. Now let's take a look at the top foods that nourish and protect your eyes. I've put my video, Foods to Protect Your Eyes, right over here. Check it out.